So let them know a little bit about critical care, what you actually do there at the VA.
Okay, sure. So in the VA, after doing residency, you're a clinical pharmacy specialist. And so for me, I'm an ambulatory care pharmacist. I work in a PACT clinic, which is a patient-aligned care team, which is something that is basically you work as a multidisciplinary provider. So I work with nurses, LPNs. At my facility, I work with corpsmen, which are active duty Navy hospitalists. And so if they were out, deployed somewhere, they would essentially be the nurses and doctors and pharmacists. So their training is very specific in the area that they work in. They can do procedures, anything like that. So I also work with, our scheduling professionals and psychiatrists, psychologists, social work. It's a very interdisciplinary team.
Yeah.
So the hope is that when your patients come in, it's a one-stop shop for care unless they need something specialized. So for me, I do women's health, ambulatory care, and I'm also the pain pharmacist for our facility. And so in women's health, I do chronic disease state management, manage diabetes, hypertension, smoking cessation, hyperlipidemia, heart failure, asthma, pretty much anything you can walk into the door with, I can manage. And if I can't manage it, I'll try to figure it out, or I'll send you to a specialist. I'm able to prescribe medications, discontinue, order labs, respond to labs. So I'm essentially their primary care provider for medication management. And so once I get a patient controlled, so say someone comes to me with an A1C or high blood sugar, A1C of 12. So the sugar is really high. Yeah. I'll manage them with the goal of getting them controlled, which would be an A1C of 8% or less, 7% or less, depending on the patient, within the next 6 to 12 months. And so, I hope it didn't cut me off. And so, medication education, device administration education. We do first dose in clinic with me, because a lot of people are scared of taking meds or injecting meds. And then once they're controlled, I try to send them on their way, but usually I've had a few patients sabotage, stop taking their meds, whatever the case may be, and then they come back. So